This video is about absence seizure. Welcome to our channel, Internal Medicine Made Easy, the online learning platform that provides medical education to healthcare professionals and students to improve their clinical skill and help them in their studies, courses, careers, and research. Absence seizures are brief seizures characterized by a behavioral arrest that correlates with generalized 3 Hz spike and wave discharges on EEG. Clinical research shows that absence seizures occur in multiple genetic generalized epilepsies, including childhood absence epilepsy, juvenile absence epilepsy, and juvenile myoclonic epilepsy. Atypical absence seizures have been reported in up to 60% of patients with Lennox-Gastaut syndrome. Triggers for seizures include lack of compliance with treatment, lack of sleep, use of alcohol, use of medications that lower seizure threshold like isoniazid, antipsychotics, withdrawal from benzodiazepines, alcohol, and other CNS drugs. Clinical presentation. Family members and teachers usually describe brief spells in which the patient has a loss of awareness, is unresponsive, and has a behavioral arrest. They describe the patient during these spells as having a blank stare. Episodes frequently occur, often 10 to more than 30 times throughout the day. Most children stop their activity completely, but some can continue the activity more slowly or in an unusual manner. Some children have 3 Hz regular eyelid fluttering. Oral automatism can also occur, especially with prolonged seizures or during hyperventilation. Children frequently have mild clonic or tonic movements in the first few seconds of the spell. Pallor is frequently reported. Urinary incontinence is rare. Spells usually last between 4 and 30 seconds. Hyperventilation, a state of arousal, sleep deprivation, and medication use can affect the duration of the seizure. These seizures are not preceded by an aura and do not have a post-ictal state. Physical examination. Hyperventilation can trigger absence seizures. To test this, the examiner asks the child to blow repetitively for more than 2 minutes. It can be helpful to use a pinwheel or a paper because this encourages the child to cooperate more during testing. If hyperventilation is done successfully, the patient will develop seizures that can be seen clinically and or on EEG. There is some evidence that absence seizures are more easily provoked when the person is in a sitting position. Evaluation. EEG is the main diagnostic tool for the evaluation of absence epilepsy. Management. The first-line treatment for absence epilepsy is ethosuximide, valproic acid, lamotrigine, and levetiracetam are other alternatives. It is important to note that some sodium channel blockers like phenytoin, carbamazepine, gabapentin, pregabalin, and vigabatrin can worsen absence seizures. Some experts suggest that a ketogenic or medium-chain triglyceride diet may be beneficial, but good evidence to support their use is lacking.